rates associated with the desire to fit in.
تعال عندي شوي أنا بعمل محاضرة. So as a question again, I was calling my son. Is the what?
Is the increased rates in depression associated with the desire to fit in?
To fit in?
Yes, maybe relating to social media and people wanting.
Yes. So what happened is in depression, as you know, depression is an illness that is happening to many people. So usually before we diagnose depression or when we diagnose depression, we need to know what kind of defense mechanism that person is using. So sometime, if you remember Freud used to say that depression is a loss of self-esteem. And depression is always accompanied by loss of self-esteem. So when your self-esteem is low, you become depressed. Also, depression has to do with loss. So if you remember from previous lectures that Freud used to say that depressed patient had some loss. Could be loss of money, loss of relative, loss of job, loss of freedom. Any loss can put you at risk of depression. So the question, is depression just a reaction to some kind of low self-esteem? Yes, it can be. But in general, depression is very, we call it heterogeneous illness. Heterogeneous means it has many reasons and it has many factors. So you cannot do, the problem in psychiatry is not like internal medicine. Internal medicine, internal medicine usually there is blood work, there is X-ray, there is something you see, you diagnose, but in psychiatry it's not. We don't have any ability to do that. So that's why depression is very broad. It is very difficult to pinpoint what is the reason, because we don't know what is the reason. 99% of depression, we don't know what is the reason for that. It's deep in the unconscious level, it's deep in the unconscious mind.
Okay, concerning the second question, the audience asked, are there any good CBT centers in Saudi Arabia that you recommend?
Well, that's a good question. We don't have any. The short answer, we don't. There is very few people who are trained in CBT. I think there is one in the university, Dr. Ahmed Al-Hadi. And I think there is a couple of other in Jeddah and here. I cannot recall all the names. But see, the problem in psychiatry is really, I wanted to understand this, please. It's not only having the good center, it's having the time. Give you an example. I had one patient who had severe depression during the coronavirus. And she was seen by 6 or 7 psychiatrists. All of them are probably much better than me in training and credential and everything. None of them were able to help her. Why? Because what happened is when you go to any center, and this is a problem here and in America, patient need time. It takes a long time to understand patient. And in private practice, if you're gonna charge 400 riyal a session, most patients cannot afford to do that and treat the patient. It usually, this lady came to me and I treated her well and she's cured now, almost. But it took me like the amount of hours it took me to fix her is like about probably 70 or 80 hours. In private practice, you cannot do that. Why? Because you are limited with money and time. Why I was able to treat her and the other didn't? Not because I am better than them, no, because I have a lot of time. So you need, in order for you to get a good psychotherapy, CBT, you have to remove the money factors and the time factors. And in private practice, it is impossible. In government sectors, it's also impossible. Why? Because in government, we don't like to work as high and we don't want to do anything. So the problem is, the reason why we were able to treat this lady, because I took it as a challenge. I did a lot of time just for her to treat her and fix her, because I know a lot about her, and it was a challenge for me, so we were able to help her. So the problem is, do we have a good centers? Maybe, I'm not sure. Second, can we treat her? Yes, the people in these centers are very well qualified. But the problem is, when she goes to any center qualified with CBT, the first thing all of the patient will tell you, the doctor looked at the hours and I was unable to tell him a lot of things. He want to do it by the book, and he want to do it quickly, and that will not work. This is a problem in psychiatry, and everybody and everywhere in the world. Is the time is our enemy. The time is our enemy. If you bring me a good patient, even complicated patient, if I have the time, I will fix him. Most psychiatrists will be able to fix him, but I need the time. And in private practice, even in these good centers, you have 40 minutes, and the physician is in a hurry, and he want to do it too quickly. He will give you assignment, and you will leave, and you will not benefit from that. Is there any problem with the sound? Are you able to hear me well? So again,
yes,
it's not the center, it's not the qualification, it's the timing. I think the most problem in our CBT treatment. Muhammad, is there any question?
Excuse me. Just
I'm upside down anyway. So tell me what the other question will be.
Sure, doctor. So the third question is, what things does an individual need to do to know they have found the right therapy or therapist?
Well, the most important thing, like this lady, all of them, she saw many big shot name in Riyadh, and she didn't like any of them. And the reason she told me, one reason is that I did not feel I was able to connect with them. I did not feel that I am able to explain everything for them. I did not have the time to tell them everything. You remember, when you want to talk to any patient and treat any patient, you need to make sure that you let that patient feel like you are caring about him. We call it positive transference. Remember, when we treat patient, there is something happen we call transference. Transference is when the patient like you, so they can listen to you. When the patient will allow you to go to their limbic system. Limbic system is where we keep our emotion, our feeling, our heart there. And we usually, patient will not let you go there unless he trusted you, unless he feel like you are listening to him. So that's why we always recommend to all students to read a book called The Art of Listening. For John Shia, this is about psychiatric interview. If you don't know how to listen to the patient, if you don't have the art of listening, the art of connecting, the patient will not benefit from you. Even though if you are the best psychiatrist in the world, even though you are trained in the best places in the world, if you do not know how to keep and how to connect to their limbic system, to touch where it's hurt, the patient need to feel like you really knows what you are doing, like you really touching the point that really hurt the most. And then he will listen to you, and he feel like you are the greatest psychiatrist because he will open up to you. Most of the time, when you see patient quickly, 20 minutes, 30 minutes, then you will not be able to do that. That's why I used to have a private practice, and I quit doing private practice, because in private practice, you need to rush and see patient more. So you go by the textbook. Oh, tell me about your sleep, your energy. Okay, you meet the criteria, DSM-5 depression, that give you Prozac. That doesn't work in psychiatry. It's not like you have a sore throat or a flu or diarrhea. It takes 6-7 session, lengthy session, to understand what's going on deep inside the patient brain.
Doctor, would you mind repeating the name of the book? We would love to recommend it to our...
It's called, the guy is not named John Shia,
okay.
And the name of the book is the Psychiatric Interview, The Art of Listening. I will send you a picture of that after the session, and you can share it.
Absolutely, thank you.
Okay, doctor. how can the struggling individual effectively communicate how they are feeling to those who believe in the stigma?
Well, we see a lot of those. I see a lot of resistance from patients. They don't want to see a psychiatrist. The stigma is still huge. A lot of patients doesn't want to come and see the psychiatrist. It just take you 1 or 2 sessions when the patient feel like you are touching and where it's hurt. The problem is the stigma is not the fault of the patient. It's the fault of the psychiatrist. We ruin psychiatry by making psychiatry such a thing that it's a medication. You know, one time I was privileged and I was honored to meet one of the old psychiatrists. His name is Abu Dahab. He is a serious psychiatrist in America. I think he died because when I met him 20 years ago, he was 9 years old. I met him 20 years ago and he was 9 years old. So I'm sure he is now 110 if he's still alive, but I don't think he's alive. So he told me that, you know, he's been practicing psychiatry since 1940s. And he told me the worst thing happened to psychiatry is medicine, because they used to treat everything with talk therapy and connection. And the patient will go to a psychiatric hospital. This is an old time, and stay like for a few months, and they will be analyzing and psychodynamic therapy. I think this is still be the best treatment for psychiatry. I don't believe that medication had made a huge difference. I think medication is not that great. It did not do psychiatry very well. I look at medication as fast food. You know, in the past, used to bring the chickens and the fruits and the vegetables and fix them at home and have very nice meal. Now you go to McDonald's and get a hamburger. That's fast food. So psychiatry now become like fast food, quick. You are depressed. You don't want to see why you are depressed. They don't want to care what is the problem with your depression. They should just slap you with Prozac and that's it. That's why I always recommend a book called Listening to Prozac. This is a book of psychiatry called Listening to Prozac. And it will show how medication had ruined the practice of psychiatry. You know, I met a patient today, one of my patients. She started crying after I met her for the first time today. And I told her, why you are crying? She's been seeing a psychiatrist for many, many years. She said, this is the first time I felt in my life that somebody cared about me and listened to me. Now, this lady has been seeing a psychiatrist for like 10 years. Many psychiatrists prescribe all the antidepressant in the world and has no benefit. Why? Because it's a 10-minute, 20-minute interview, get a medication, you have this illness, DSM-5, get this medication. And the problem is there is no two patients alike. I think Dr. Khalid mentioned that I'm more and more likely not to prescribe medication to any patient. You know, I was trained under one of the analysts, and he really doesn't believe in medication. He feels medication really is bad. Now, I'm not that extreme. I still feel like medication is important. We need to use medication, but we are underutilizing the psychotherapy, the connection with the patient. So bottom line, the gold standard in any psychiatrist practice now to be very successful is to touch on the heart of the patient. See where is this coming from, not just look at psychopharmacology in general.
Doctor, the next question, I'll take it from the chat because the live people who are here have a priority. So what is the correlation between depression and anxiety? When do you think one should head to a... And then the question stops. Hiba, would you like to continue?
Yes. So almost always, most depression was anxiety. Most depressed patients have anxiety, and most anxiety patients have depression. Sometimes depression and anxiety is like al-khubar with dammam. When I go there, I didn't know whether I'm in al-khubar or in a dammam. It's very convoluted. They are very, you know, connect with one another. So the problem is not to distinguish between anxiety and depression, because you don't have to do that. You need to know whether he's more likely to the depressive side or to the anxiety side. So most people have both, but some people have like 60% anxiety, 40 depression, or 90%. Or so see where is more in the is it depression or anxiety? And treatment will be different. Why? Because When you are anxious, you become depressed because it's the same real state in the brain. It's the amygdala that do both of them. So anxiety usually worry about the future, what's going to happen to me. Depression is more likely worrying about the past and why I did that. So that is the difference in a nutshell between the anxiety and depression. Those live in the future and the other live in the past. The medication are the same and the treatment is a little bit different, but the medication are the same. But when we treat depression, we start with a high dose of antidepressant. When we treat anxiety, we start with a low dose of antidepressant because, as you know, antidepressant work for both of them. But in anxiety, in more anxiety patient, the antidepressant will make them worse at the beginning. Now, the problem is when you have combination of anxiety and depression, it's more likely that you're going to commit suicide because there is a huge increase in risk of the suicide when you have both anxiety and depression. Because when you have depression, you don't have any energy to do anything. So even if you're going to kill yourself, you don't have the energy to go to the kitchen and grab the gun or the knife and kill yourself. When you are anxious, you are depressed, but you have energy to do that. That's why it's, but always when you have anxiety and depression, it's going to be worse. So always it's worse to have both anxiety and depression. Now, the other question I see here is depression is genetic? Yes, it is genetic. So you always, in any illness in psychiatry, you have to have the gene and the environment. So maybe I have the gene for depression, but I don't have depression because the gene did not activate it. So you need the gene and you need something to open that protein that causes the gene to be methylated and start making some protein to make you depressed. So the gene is in the what we call the SERT gene, is the serotonin transporter gene. That's the one that make you depressed. So if you have the short gene from your mother and father, then you're going to be depressed. If you have the long gene, you are less likely to get depressed. So it's dependent on what gene you have. If you carry the long version of the gene, then you're going to be immune to depression. Now, most patients will get one from their father, one from their mother. So they usually have one short and one long gene. So they are in the middle. There is nothing called 100% treated. In psychiatry, there is no treatment. I'm sorry, there is no cure. Most illness will not be cured. It will be treated, means it will get better. And with the treatment, you will show some improvement. But there is no cure. Why? Because it's when you get depressed, the problem why they want you now to go aggressive in treatment of depression is because when you are depressed, then a part of the brain start dying. When this part of the brain start dying, you will never be able to get them back. So that's why you need to be very aggressive in treatment of depression. So you save some of the brain cells from being deteriorated. These brain cells in the hippocampus, we said, is the part of the brain that go bad when you are depressed. You have shrinking in the hippocampus when you are depressed. So treatment of depression, not bring back those cells, but to prevent other cells from dying. So the good cell will compensate for the old cell. So there is no cure for depression. There is a treatment, and there is nothing 100% in psychiatry. I don't think there is anything 100% in life.
We have
a question from. Okay, go on.
We have a question from a submission. How do you know you are depressed? And if you could please also cover postpartum depression, if possible.
Okay. So you know you are depressed is when you say, like this guy I saw today, he is a doctor, and he's never been depressed before. He came to my office. He's one of my friends. He is 44 years old. At age 44, most of us will get depressed for many reasons. I'll tell you why. So he started telling me, he said, I'm not depressed, but look, I don't enjoy anything anymore. I used to enjoy going to prayer, Al-Fajr, I don't do that. I used to enjoy working in the ER. I don't do that now. I don't enjoy it. Family, I don't enjoy it. So when you see this lack of enjoyment, and hedonia is key part in depression, feeling anhedonic, not able to enjoy anything. Of course, we find out today, he told me today, after I listened to him for 2 hours, he told me that he is married and have kids, and he loves his wife. But apparently, one of the reasons for the depression today is he met somebody and he fell in love with her, and he is confused now that he is unable to marry her. He cannot tell his wife about his feeling, and he cannot tell this girl that he loves her, and he is thinking about her day and night. That cause him to have lack of sleep, and lack of sleep cause him to have anhedonia, where he doesn't enjoy anything, and then he is depressed. So see, it's very, very complicated. Now, it's not easy for a guy like him to come to my office and tell me, look, I'm in love with someone else and I still love my wife, but I have another love for another lady. So this guy today, he was crying, he was in severe depression, but on the surface, he didn't show that. But people around him are telling him, you don't look yourself. You seem to be internally preoccupied. You seem to have lack of enjoyment. You always have trouble with the sleep. You wake up and you don't have anything to wake up for. You feel sluggish and tired. You have no interest. You feel empty. One of the way we feel depressed is when we feel empty. Feeling empty means we look in darkness at the world and we don't have any enjoyment deep inside us. And usually this guy said, if I don't see this girl every day, I don't feel good. If I go to the ER, she is working with him in the ER. If I see her in the ER, then I have a good day. If I don't see her, I don't feel anything. Remember the guy I told you in America, he was my roommate. His name is Firas, and he was in love with a lady. And he told me that every day he feel miserable in the morning. Then in the evening, we go and circle around her house for 3-4 times. We don't see her, just circling around her house will make him feel relaxed and happy. So apparently the depression and anxiety are deep in the midbrain, and the midbrain is the most ancient part of the brain. This is where dopamine comes from. If we don't have dopamine pouring out of this place in the brain, you're going to feel miserable and you're going to have empty feeling, means sadness and having no enjoyment. And that in ancient part of the brain called the midbrain is very, very primitive, and we don't have control over it. So we don't have the ability to treat our depression ourselves. We have to depend on other to give us that feeling of happiness. And so you need to look, each patient get happy with something. Some people get happy with food. When I see falafel and hummus, I feel cheerful and I feel very happy. Some people, when they see beautiful girls, they bump up and feel relaxed and feel happy. So it depends which things that make you happy. And that's different from one person to another. And most of our life now, especially with the coronavirus, with the economic problem, we don't have much things to make us happy anymore. Used to be seeing my family make me happy. Now I don't see my family. I was unable to travel. I cannot go on vacation. You know, what makes people happy usually? Vacations, family, money. There is none of this now with the economic crisis after Corona. You cannot even visit your parents now. And that's scary for everybody.
Thank you, doctor.
Did I answer the question?
There is one minor point about postpartum depression, if possible.
So postpartum depression usually happen in the first year after delivering the baby. Most of the cases, we call it postpartum blue. Postpartum blue is like mild depression. This happened in about 40 to 50% of the ladies. I think it happened to 90%, but the figure is 40%. And this is normal sadness, a little bit of, feeling bad and feeling scared and feeling anxious. Then this postpartum blue can be more severe and call it postpartum depression, which is about 10% of the population who deliver baby will have postpartum depression. Postpartum depression is severe depression. It might be related to lack of GABA receptors in the brain, because when you are pregnant, you have a lot of GABA receptor de novo. That GABA receptor will make you calm and relaxed and happy. When you have delivery, estrogen goes down and you lose all of these GABA receptors and you feel very, very anxious and very, very depressed. A treatment should be treated aggressively because postpartum depression is very debilitating disease. It can kill ladies in a way that most of them will commit suicide or hurt their babies. It usually happens when the family, why it's more common right now, because of the lack of social support. So usually when a lady gives birth, the whole family will celebrate, everybody around her will come and visit her, the whole society, her relative, everybody will treat her like a queen, she brought a baby. Nowadays, with the family disconnecting, the lady feel alone when she delivers, so she doesn't enjoy that joyful feeling. Adding to that, the baby will cry all night and the lady will not be able to sleep. She feel anxious about the future, because now uncertainty is what kills us. Most of the reason for depression now and depression for anxiety is uncertainty, because like I am here and I'm Syrian, American, you are Lebanese, you are Chinese, you live here in this society, you don't feel secure about your job, about your future. That uncertainty, especially when you are pregnant, it's going to add to the uncertainty. You don't know what is the future for your kids. That will make your life miserable and cause a lot of psychosocial stress, including postpartum depression.
All right. Doctor, a question from audience. The person is asking, I'm surrounded by downfalls. I'm not getting a job, not renewing my residency, and I'm always surrounded with troubles. So I'm kind of feeling of depression. This kind of depression will block me from thinking and finding solutions.
Yes, and that's the depression that need to be treated quickly, because this is what we call depression with cognitive issues. When you have cognitive problem, that means you are not only having problem in your serotonin, then you have problem with dopamine, because dopamine is what gives you the motivation. So he had depression with procrastination. Procrastination is postponing things, not being able to have motivation to do things. That part of depression is hard to be treated. So he need very, very complicated psychopharmacology, and he need very, very good psychotherapist to get him out of that, because here is not depression is that coming from the limbic system that make you emotional and crying. Is depression that also coming from the frontal lobe. When you see executive function, cognitive function, that's mean not only the limbic system is getting involved, but also the part of the frontal lobe that is responsible for the executive function of the brain, and that is very difficult to treat. You have to reinvent these brain cells again and let it work. And part of that depression will not respond to the typical treatment of depression like SSRIs. You need more complicated psychopharmacology. You need probably a little bit more complicated treatment than just regular antidepressant.
Doctor, we have a question here. Where do you draw the line between maintaining a positive outlook and battling negative thoughts, and simply ignoring your feelings and bottling them up? How do you know which one you're doing?
Yeah, this is the role of the psychiatrist. You cannot do it on your own, because the limbic system is very, very complicated. The limbic system is one of the things that God created, and it's really, really very, very convoluted. Feeling are scattered there. Emotion is flowing. It's like a volcano. You don't know which one you're going to tackle. So you cannot draw the line here. You have, when you are depressed, your thinking is coming out very convoluted, very complicated. You need somebody to like remove that convolution and straighten things out. And you cannot do it, especially if you are depressed. You need to go to a specialist, to a psychiatrist, who will be able to figure out where is the problem and how you can tell. Like this guy who came to me today, he is depressed, and then by the time he started talking, I felt immediately that there is a lot about feeling and woman and emotion. So always when you see things very, very convoluted, very complicated, that's mean this guy or this lady is having some kind of problem with the biological clock, the feeling of love. Always when you see things very convoluted, that's mean we are really scared about the future. So you need a psychiatrist to help you with that. You cannot draw the line yourself. You really need somebody to help you. And unfortunately, like we said in the beginning, there's very few of those who can really help you and tell you what's going on in your brain, because you don't know what's going on in your brain. That's why you need to train to see a psychiatrist all of your life. You always have to see a psychiatrist or a psychologist to help you go through this feeling you have. Like this guy we saw today, he is 45. Immediately, anybody at 45, he will be going through midlife crisis. So there is another love in his life, and he loved his wife, and he's loving this new girlfriend. So he is getting very, very confused. There's a lot of conflict deep in his unconscious mind, and you need to go to this conflict and try to sort it out. You just don't give him antidepressant and treat it. This will not do well on antidepressant. As we told you, we are relying too much on medication. This guy needs somebody to figure out what's going on in his brain and how, because he was feeling guilty about loving her. And I told him, loving a person is not in your hand. It's deep in your primitive part of the brain. So part of being depressed today with this guy is he feels guilty about loving this lady. And I told him, you cannot feel guilty about some feeling, because feeling is not in your hand. Is not part of you. It's deep inside you that you cannot control. So most of us, when we have depression, when we have anxiety, is deep in our unconscious mind, and we are unable to control it.
Thank you very much, Doctor. Next question. We have some chat. Is overeating a side effect of depression?
Yes, overeating is what we call atypical depression. So usually when you are depressed, you don't sleep and you don't eat. If the opposite happens, if you eat a lot and you sleep a lot, this is depression we call atypical depression. And most likely that depression is bipolar. So later on, you're going to discover that it's not pure depression, it's bipolar depression. And the treatment will be different. That's why when you give them antidepressant, you make them more. They start eating more and more. So those patients need different kind of depression, the treatment. The SSRIs will not do well on those patients. They need probably a mood stabilizer. You need to screen them for bipolar in those patients, because 90% of the case, you're going to find out that these are bipolar patients, not depression patients.
Okay, someone is asking, what are the signs that confirms a patient is recovering from depression?
Well, usually I learned from Stephen Stahl. He said, whenever you see a patient with depression, you ask him or ask his wife or his significant other, what is the thing you used to do before you get depressed? Like, used to go to the zoo, used to go to Riyadh Gallery, Riyadh Park 3 times a week, visit family, play golf, go and horse riding, go to, for example, McDonald's, or go to eat kapsa 3 times with your aunt. So you write 7 things that you used to do before you get depressed, and you try to work on him and getting the 7 things that he used to do before depression, see if he is completely recovered. If you go 6 out of the 7, then he is partially recovered. So this is how we can treat him. Put 7 or 8 goals and follow these goals and see if you can reach that goal again.
Okay, we go with Aya.
So should a person that is a danger to themselves go to the emergency room in case they severely harm themselves?
Well, you know, one of the most common problem we have in depression is suicide. Suicide is the reason why most psychiatrists get sued. Suicide is 12% of the people with depression and bipolar end up killing themselves. So you have a huge number of people killing themselves. So anytime you have any suicidal thought, you really need to go to the ER as soon as possible, because ER physician will help you go through this, and psychiatric consultation will help you. So this is one of the psychiatric emergency. That's why I am on call every night. I am on call. I get called through the ER 1 or 2 times to treat suicidal patients. Okay.
Munira, you can go ahead. You can ask any question you like. You can unmute yourself.
Doctor, I just wanted to ask if antidepressants are a solution, or they just make you avoid the problem, avoid depression.
Okay, let me share this with you so you can understand antidepressant. I will share this screen. 1 second. Okay, here we go. I will do share the screen. 1 second here. Let me see here. Can I share the screen?
Yes, doctor, please.
They say the host disabled participant screen.
Yes, let me change that. Okay, yes, now inshallah you can.
Okay, so here we go. This is the principle of treatment of antidepressant. Okay, see it, you see the screen now?
Yes, doctor, we can see it.
So here is the red one is the limbic system. This is where our emotion, our feeling, and our, I'm sorry, our emotion is there. When you hate somebody, when you love somebody, when you are crying, it's all in the limbic system. And you see the limbic system is like protected deep inside the brain because it's one of the most precious part of the brain that make you connect with people, make you laugh, make you happy, make you cry. All of this is deep in this limbic system. When you are depressed, there is a huge amount of emotion in this limbic system. That huge amount make you cry because you cannot verbalize this feeling you have in the emotion here. So that's why they teach people when you are a kid, they teach you how to draw, write poetry, and write stories. They want this emotion here to be expressed by the frontal lobe. The frontal lobe is the one that we express those emotions. For example, when I love a lady, love is deep here. So I express my feeling by writing a poetry, going buy her a flower or gold ring. All of this is expression of this emotion. When I cannot express this emotion, I feel threatened, I feel scared, and I start crying because I'm not able to express this emotion. So limbic system is where we keep our emotion. Frontal lobe is where we express those emotions. So when we are depressed, we have plenty of feeling or plenty of emotion in our limbic system. We start crying. When we give medications, one of the all of the medication, what they will do is they decrease the intensity of the emotion in the limbic system. When they decrease the intensity of the emotion in the limbic system, we stop crying, we stop feeling depressed. But we also, one of the side effects, the patient will tell you, I don't have any feeling left. So what we call it in Arabic, تبلد المشاعر, where we don't have any feeling left. Not only we decrease the feeling of anxiety, but we decrease all the feeling. But the patient feels fine because she doesn't want to cry, she doesn't want to feel threatened. So medication do two things. It makes the area of the limbic system less active, so you feel calm and less threatened. It makes the frontal lobe more active, so you can deal with this threatening in the limbic system, because part of the depression where the limbic system is not able to express those feelings in your limbic system. So it will make the frontal lobe express those feelings. You are feeling less threatened. You look at things with not as scared fashion, not a threatening fashion, and you feel fine. So the role of medications here is to make you feel less threatened. You have less emotion in the limbic system, and you are able to deal with this emotion. Is that clear?
Yes, doctor, thank you.
Yes. We have a question from Hibba Idris. You can unmute and ask the question.
There is a lot of noise in the background, so can you? Okay. Go ahead. What is the question?
Hibba Idris, you can ask the question.
Okay.
Okay, I think she's fixing her mic. Until then, someone is asking, there are two friends of mine, both of them are utilizing drugs. The one is depressed, the other one is fine. He believes that the one who is depressed and using drugs to specify he was smoking marijuana, he has not he has felt sick and changed it totally, while the other one who is using but he was not under depression is feeling fine. So he is saying that he believes that if someone is utilizing drugs with depression, consequences might be more severe than the other one who is normal, just using it for fun. What's your comment about that?
Well, marijuana is what it does. Let's go back here. Marijuana, it's called, when you smoke marijuana, there is a phrase they use in America. They said he is a stone on hashish, stone on marijuana. Stone means, you know, when we say the limbic system is the emotional feeling here, SSRIs or antidepressant decrease that emotion. Marijuana will kill all of this feeling and emotion. So you become like a stone. A stone means you don't have any feeling. You become like a stone. Like a stone doesn't have any feeling. The word stone came, you see, you put in the mental status exam with the patient, he is stoned on marijuana. Stoned means your affect, your face, your feeling become like a stone, no emotion whatsoever. No, SSRI decrease it, but marijuana will kill that feeling. And it make you feel like a couch potato. Yes, you don't have anxiety. Yes, you don't have any feeling also. You don't have any emotion. You don't have anything. You are just a piece of furniture. I think that's not what God sent us to earth to do. That's why marijuana is the most harmful substance in the world. There is nothing more dangerous than marijuana in the whole world, because it killed the white matter in the brain, and the white matter is the most important white matter that God sent us to earth to help build this earth. So doing well on marijuana, yes, most anxious patients will feel better, yes, but they don't not only feel better, they don't have any feeling left. They become like a stone. And look at the literature and they will tell you like he is a stone in marijuana. So marijuana is useful for some patients, but it's 99% of the patients who smoke it will do more harm than good. Marijuana is good for some patient who is dying from AIDS, dying from cancer. It will be a good, you know, for pain, for anxiety, and those kind of patients. But for a guy who is a medical student, this will kill his feeling. It will cause him to have what we call the ovulation syndrome, where you don't have any motivation or any feeling or anything. You just eat and sleep and enjoy your life like this. So it gives you false sense of happiness.
Doctor, thank you so much. We have another question. If a person is suicidal and wants to or is going to kill themselves, what should they do when no one is able to help them? Like if they go to the hospital, would hospitals be sympathetic or would they be dismissed?
No, most hospitals will treat them. They will bring a psychiatrist. They will have a plan B to help them go through this. So there's a lot of help we can do for those patients. So please go to the hospital and seek help if you have any suicidal thought. There is plenty of help. There is medication now to help you quickly. There's a lot of medication that take care of that feeling of anxiety and suicide.
Another submission asks a similar question, but she asks how to save someone who has suicidal thoughts. I am really worried for my friend. So from a friend's point of view, how could a friend...
Well, if you have any... Look, suicide is a feeling, you know, you want to kill yourself because you lost hope. So you have to rebuild that hope and see where the lost hope is coming from. That's mean they gave up on life. They don't want to do anything. They mean most likely they have been using drugs or using something. So you need to help them by talking to them, listening to them. Somebody, when you see somebody listen to you, just the mere listening to you, they might feel better. Just listen to them. Show them that you care. This is the most important thing you can do for them. Show them that you care.
Thank you, doctor. Does depression have a cure, or is it something that a person is born with?
It's both. You know, depression, as we said, you inherit it from your parents, and you inherit the gene. Inheriting the gene doesn't mean that it's gonna make you depressed. It's gonna be vulnerable for depression.
Yes.
So if you have the environmental factors, you will get depressed. If you don't have them, you're not gonna get depressed. So this is one caveat. It's depend on what you get from your family, and can you control it? Yes, you can control the gene. It's like obesity. You might inherit the obesity from your family, but if you don't eat, you're not going to be obese. So it's depend on the environmental factor that make you eat a lot or not eat at all.
The last question we have from previous submissions is, how do you know if someone is relieved from depression? Is it the same as you said earlier, if they have an interest in maybe 8 things and they regain that interest?
Yeah, they need to regain back that interest. They need to function well, like you feel inside that you have energy, your thought is clear, you don't have any suicidal thought, you look at the future as a bright future, you are very optimistic, you talk to other people, listen to other people, and you are a positive person in your life. So you look at things in a more positive way. You don't feel threatened and you don't feel anxious.
Okay, I think Hiba fixed her mic. Go on, Hiba, you can ask the question.
Okay, thank you. Can you hear me?
Yes, yes.
Okay, so when someone's behavior changes, all right, for like a very long period of time, like when someone's very outgoing, very funny, and smiles a lot, and has a great sense of humor, changes to be very dull and dark. And when you confront that person what's going on and try to ask that person like some certain questions, that person's response is either I don't know, or you won't understand even if I tell you. So how can you diagnose this person, and how can we help or treat
when
this
he
person?
tell you that you don't understand, that's mean, we said feeling is deep inside the limbic system, okay? And not everybody, emotion and feeling is deep in the limbic system. And not everybody can be invited to that place. So that's mean when he tell you that you don't understand and he doesn't want to talk, that's mean he doesn't trust you enough to get you in. You are not using the right tool to go to this most secreted place in his brain. So people don't let anyone go there. It take me 3-4 sessions with any patient before he start open up for you. So that's mean he doesn't trust you. He doesn't want to talk to you. You are not a worthy person for him. So sometimes you need to talk about what hurt. Most likely, most of us, what we carry here, our parents, our kids, our loved one. So when you see somebody not talking, that's mean he is internally preoccupied. And the most thing worry us is really our future and the future of our kids, our relation, our loved one. So always like this guy who came today to me and he said, I am depressed and all of that. I told him, tell me about your marriage, tell me about your wife, tell me about any love, new emotion they have. And he started to open up because I touched on the right spot. So when you see some patient like this, when you ask him, do you feel guilty about anything, or tell me about your sleep, or tell me what is your plan for the future, you are not touching where it's hurt. You need to touch where it is hurting. Most of us, I start asking him, tell me about your kids, what they are doing, what is the future, then they will open up. So what open up is usually wife, parent, kids, all of that really hurt and worry about. You don't ask him about something irrelevant. That will not make it open up.
Okay, thank you. Thank you very much.
Mm-hmm.
Do we have any more questions?
We don't have any of the previously submitted questions, but if anybody here has any more questions, please feel free to ask.
Okay, doctor. What's your advice for the current situations and the hard times people are going through, and not to fall into depression? What do you advise them? What do you advise them to do? Yes, strong and not to.
The first thing when you see a patient, first of all, you need to build a rapport with the patient. The patient need to like you and admire you and feel like you are want to help him. If he doesn't feel this way, it's a waste of time. If you feel like you just want to come and write prescription, is not going to work. You need to let the patient feel like you really care about him. If he doesn't have that feeling, it will not work. Let him feel first that you connect with him, able to reach his limbic system, reach his love place in the brain, and then start build on this. If you don't do that, all of the therapy will not work. All of the antidepressant you give him is not going to work, because you have to sell that antidepressant to the patient. Talk about where is the most painful things for him. You know, I have one patient today. I just saw him today also. He's 62. He lost his son, young son, suddenly with a car accident. So he come and cry, and every time I see him, I start talking about this, and he feel very connected to me because I know where it's hurt. I don't ask him if he take medication or not. I don't ask him about side effect of medication. I don't ask him about anything irrelevant. I always ask him about where is the feeling. Tell me how you feel today. It was, you know, very hard to lose a son. All of this is where you want to be. You just don't want to shrug over the important feeling that you have. Always go with the patient's feeling. When you go with his feeling, he will like you, he will listen to you. Okay.
Okay, but someone is saying, as a normal person, not to fall into depression. What do I do? How do I?
You need to visit 5 rooms in your day. I always tell your patient need to visit 5 rooms. These rooms are your family. Make sure you are connected with them. Call your mom, your dad, your kids, sister, brothers. Always keep in touch with them. Second room is exercise, because exercise will raise your serotonin. So I always tell my patient, you can take the Cipralex 10 milligram, or you can walk an hour a day. If you take walk an hour a day, it's like you get the same serotonin from walking than from the pill. The second thing, be positive. Always when you wake up, thanks God for the day, and prayer and dhikr and reciting your religious things, it will help you a lot. So you need to visit the exercise room, the family room, the God's room, and the positive thinking room. Also eat healthy food. Healthy food always very good for you. If you eat junk food, McDonald's and Kodo is gonna make you depressed, because all processed food will deplete you from these essential nutrients. Always food, exercise, prayer, family, and positive outlook at life. If you visit these 5 rooms, you will be fine. And if you have anybody who is depressed or give you negative feelings, stay away from him, because once you live with a depressed person, you're going to increase your depression by 17%.
Really, doctor, today's topic was very overwhelming, and it's very hard to discuss within an hour, but you really made it to be very easy for us and for the audience, and we really thank you for that.
Thank you.
I have
Doctor,
any comment?
Thank you so much. I just want to thank the
Thank
doctor.
you, Aya.
And Alatik Al-Fafi, we really appreciate all of the
Aya, anytime.
We hope all the audience benefited today, and have a nice day, all of you guys.
Okay, thank you.
All right. Thank you so much.
Thank you everyone for coming. Thank you, Muhammad, for all your help.